been reporting throughout the day here at News 5. Even before that, there were 2 new cases of measles, and both have links to Massachusetts. State health officials say that the search is on for other people who may have been exposed. So let's talk about it. And joining us right now is Dr. Todd Ellerin from South Shore Health. Good to see you. Happy Friday.
Good to see you, Eddie.
We've talked about measles before, but now we have some meat to talk about because there are outbreaks, obviously, in other parts of the country, and it's been that way for more than a year. Did the risk of having one here just go way up?
Not really. Why? Because most of us in Massachusetts have been immunized. Our rates are high. And for that reason, these 2 cases, first of all, both were acquired internationally. They weren't acquired in Massachusetts. Right. The child wasn't even in the United States when the child was contagious. So there's 1 case. There were other exposures. We'll have to see what happens. But remember, Eddie, over the past 10 years, 8 cases, Massachusetts is doing really well.
Yeah,
Not worried.
So if we know for a fact that we have been vaccinated, and for example, I'll use me as an example. I was vaccinated when I was a young guy. Do I have anything to worry about?
If you've been vaccinated, you do not have anything to worry about. The people who get measles are those that really haven't received any vaccines. And I think that's the bottom line. Think about the measles vaccine is like the superheroes, like Superman.
Right.
And measles itself is like Lex Luthor.
Yeah, okay.
So literally you have a powerful villain, the most powerful superhero. In the end, the superhero wins unless you're not immunized.
What if you have a complication? What if you have cancer, for example? You have been vaccinated, but you have cancer. What is there a complication in there?
Well, the issue is there's certain populations that can't get the measles vaccine. One is kids under 6 months of age, and the other is those that are severely immunocompromised. For that reason, it's even more important to make sure our community immunity level is as high as possible to protect those that are vulnerable.
And it is fair to say that the measles is still very rare here in Massachusetts, right? So, but there have been 8 confirmed cases in the past 10 years. Can you remember the last time that Dr. Ellerin had to take care of one?
And the answer is no.
Yeah.
And why is that? It's because the measles vaccine works that well. One of the problems is it works so well that we don't see cases. And when you don't see cases, you can have what's called historical amnesia. You forget what it was like in 1960 before the vaccine, when there was 500,000 documented cases, probably more like 3 to 4 million cases, 50,000 hospitalizations a year, and about 500 deaths. We're doing much better than that, but we don't want to go backwards.
Dr. Ellerin, thank you so much.
Good to see you, Eddie.
Focus